Hello there and welcome to Prager FU, a new series where I take a look at and debunk the lies and propaganda of right-wing pretend university Prager U, which is really just a YouTube channel founded by conservative bootlicker extraordinaire Dennis Prager. And I say, hey Prager, F you. You see what I did there? Oh, I'm so fucking clever. And the reason I wanted to do this series is because Prager has been churning out such a volume of low-grade far-right garbage that I had to combat at least some of it. I've mostly ignored them so far, but no longer. No longer, I say! Anyways, as with my other series, these episodes will happen as and when I can be fucking bothered to do them. So yeah, let's get the first one going, shall we? As we take a look at Prager U's hatred for socialised medicine. Now I wonder why Prager U, the propaganda outlet for fracking billionaires and neocon shitstreaks, the Wilkes brothers, would be so against single-payer healthcare. It's almost like conservative arseholes don't actually care about the countries they're from, and are more interested in lining their already full pockets with more money than they are with, the well-being of their fellow compatriots. Intriguing. Kind of puts Prager U's constant bleating about their supposed love for the little guy into some perspective. It's bullshit. It's total bullshit. Now, just a quick note. What I'm about to say in terms of my critique of the American healthcare system is in no way aimed at undermining or trying to belittle in any way the American healthcare workers themselves. The doctors, nurses, surgeons, porters, etc., of the American healthcare system who, actually work at the coalface, do amazing work and work incredibly hard under incredibly difficult conditions, and I love them dearly for it. They save people's lives day in and day out. My criticisms of the American healthcare system are of the system themselves and those who impose them for their own corrupt financial ends. But anyway, on to the video itself. Take it away, token Asian dude who is presenting this video to show that Prager U is totally not racist. Honest.
It's very easy for a politician to stand up before voters and say healthcare is a right, and then passionately advocate for single payer or free healthcare or Medicare for all, whatever term they might use.
Why is that so easy to do? I mean, could it be that it's actually a rather popular thing? Indeed, look at all these countries who have this evil socialised single-payer medicine system. And how many of those nations have voted to get rid of that system? Yeah, that's right, not fucking one of them. Yeah, socialised medicine, which, by the way, is only really a term used in North America, but whatevs. Socialised medicine is what actually looking out for the little guy looks like.
But before we consider the merits of the government managing your healthcare, and that's what this all boils down to, maybe we should ask a more basic question. What do we mean by healthcare? Because if you get sick, and here we're talking major illness or you're in serious pain, you don't just want healthcare, you want quality healthcare. And where is your best chance of finding that? The answer is right here in America. For skilled doctors, cutting-edge medical treatments, and care without long delays, no other country rivals the United States. Not even close.
Oh, fucking really? What you got for me?
No other country rivals the United States. Not even close. Nobody from Texas is going to Canada for medical treatment. It's almost always the other way around.
Perhaps so, although it's difficult to tell because, as with every other fucking claim you make, you leave no source whatsoever, so you could be pulling it whole clod from your fucking anus, and I suspect often you are. But what sure as fuck is happening is that people are travelling from America to Canada to buy prescription drugs at prices that they can actually afford, so that they don't, fucking die. Yeah, poor people don't really get healthcare in America, quality or otherwise, and the socialised healthcare system in Canada subsidises the evil, grasping, profit-driven system in the United States. Yes, that's right, the American system is underpinned, to some extent, by the Canadian taxpayer, and yet pricks like you have the temerity to turn around and criticise the Canadian system, you ungrateful little shit. In fact, so bad is the state of affairs for the free market solution of the United States that many states of that union are in the process of creating specific agencies for the purpose of bulk buying prescription meds from Canada in order to distribute them throughout the pharmacies in the states themselves. Yes, America's healthcare system is an international fucking joke. So much like Prager U, really.
Sure, our healthcare system has lots of issues, and we should address them. But do we really want to upend all the advantages that we do have and start from scratch? Because that's what would have to happen if we completely turn healthcare over to the government.
Notice how we just quickly glossed over the problems in the current system? Yeah, let's not talk about those whatsoever. No. And also, what fucking advantages are you talking about here? You are the richest nation in the world, and your healthcare system is fucking terrible, and there are millions of your citizens with little or no coverage whatsoever, you dick.
So let's imagine we make the change. We hear a lot about how great free healthcare would be, but it's only fair we look at the downside. The first is that government-run healthcare takes medical decisions away from patients, that means you, and puts them in the hands of bureaucrats.
Well, that's not actually correct, is it? Because at the moment in America, patients don't make the decisions. The insurance companies do. The drug companies do. There are already bureaucrats taking the decisions in the US, and they have absolutely no public accountability whatsoever, and are only interested in making profits, unlike in the supposedly terrible single-payer systems. And that's for those who even have coverage. Those that don't, and there are 44 million of those, and a further 38 million with inadequate coverage, they have absolutely no decision whatsoever. Their option is either to go into crippling debt, or just die. I mean, what, yay freedom? Is that what you're expecting people to say to that? Jesus fucking Christ.
They decide, for example, how many MRI machines are going to be available, or under what conditions you can get back surgery, or a bypass, or even whether you qualify for cancer treatment. That's how it works in the United Kingdom, under its single-payer system. Because it has finite resources, the National Health Service, or NHS, sharply restricts access to treatments like hip and knee replacements, cataract surgery, and even prescription drugs to deal with common conditions like arthritis and diabetes. If you suffer from any of these ailments and many others in the UK, you may just have to live with the pain.
That's another fucking lie. There are very few cases of anything like that in the UK. And I'd like to have checked Prager U's source for this outrageous bullshit, but once again they didn't leave a link to any fucking source whatsoever, so I'm going to go ahead and say they pulled it right out of their anus. Also, dude, as an advocate of the American-style healthcare system, you are in no fucking position to go on about people just having to live with the pain. According to a 2018 CDC report, linked below, 1 in 5, a fifth, of the American population lives day to day with chronic pain. 1 in 12 live with chronic debilitating pain. Now, not only does that mean that a very significant proportion of Americans are living in fucking agony day to day, but there's also the problem that this feeds into the opioid crisis in America because people get prescribed painkillers, they get hooked on them, they then lose their insurance and have to go and find illegal ways of doing it, and they get sucked into the fucking system. It's also not financially particularly great either because it costs nearly $600 billion fucking dollars in lost productivity, incurred medical expenses, and benefit payments. So no, the American system is in no fucking position to lecture anyone else on letting down its sick citizens.
And let's hope you don't have a medical emergency. In a January 2018 article in the New York Times, patients in emergency rooms around London are described as having to wait 12 hours before they are tended to. Corridors are jammed with beds carrying the frail and elderly. To deal with the situation, hospitals were ordered to postpone non-urgent surgeries until the end of the month. That hardly seems like an improvement over what we have in the US.
Firstly, I find it interesting that you cite the New York Times here. I suppose it's not fake news when it agrees with the narrative you're trying to spin, eh? Secondly, the story you cite is clearly an extreme case. Not that anyone would necessarily know that because once again you didn't even leave a link to the fucking article. It's almost like you're trying to hide something from your viewers here. Oh yeah, that being that the problems currently faced by the UK National Health Service are due to the austerity imposed on it by a Conservative government, who have always sought to undermine the NHS at every turn. Yeah, how very dishonest of you not to mention that. Also, in terms of getting to see a doctor, that's actually quicker in the UK than it is in the US. And unlike you, I've left sources to all of my information in the description box below. So no, the American system is not better than the UK system, you dickhead.
A second big problem with single-payer systems is that they are expensive. Really expensive.
Oh, hello again, Billy Bullshit. Actually, I think you'll find that the UK's health system is considerably cheaper than that of the US. Let's take a look at the numbers, shall we? Oh, would you look at that. The United States spends $9,403 per person, whereas the UK spends $3,395 per citizen, less than half that amount. Yeah, our system is way cheaper. It covers every person in the country, unlike in the US, and we get better health outcomes and efficiency. And if you look at these graphs, and I'm just going to skip by these very quickly, so if you want to actually look at them, you're going to have to pause the video. But these come from a World Health Organization study. It shows that various nations, many of whom have socialized medicine systems, outperform the United States in many key areas. In fact, the World Health Organization ranked its member nations, and the findings were very interesting. Were America in the top 10? No, they fucking well weren't. But several countries with socialised medicine were. And were they in the top 20 even? Nope, but several more evil socialised medicine nations, including the United Kingdom, who you told us were a pile of shit healthcare-wise. Well, we made it into the top 20, unlike the United States. But surely America made the top 30, right? Nope, not there either, but lucky who did make the top 30. Canada and its monstrous healthcare system that you just informed us was a bag of cow dicks. Well, they're above America too. So did America even make the top 40? Well, yes, just at 37th overall position, wedged between the two global economic powerhouse Goliaths of Slovenia and Costa Rica. Now, no offence intended whatsoever to Costa Rica or Slovenia, this is just a financial thing. But come on, America, if you are the richest nation ever to grace the planet, and you cannot beat out the tiny Central American nation of Costa Rica in terms of healthcare, you're doing something very, 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 very wrong. Also, those numbers show us that Prager U is full of shit. That's a big takeaway from those numbers as well. Let us not forget that for a second. Now, whilst of course it is true that the American system outperforms several of the single-payer healthcare systems of the world in various key categories, firstly, that shouldn't be surprising because you are the richest nation that has ever fucking existed, and obviously still therefore the richest nation on the planet now. You have a very significant advantage there. But secondly, considering that you are the richest nation in the world, and you spend way more per person, how are these socialised healthcare systems able to beat America in any category whatsoever? Clearly the American system is fucking terrible if, given all of the advantages it has, it still loses to the socialised healthcare systems of much poorer nations, for fuck's sake. So stop talking shit, Prager.
A recent study by the Mercatus Center at George Mason University found that a Bernie Sanders-style Medicare for All health system would cost a tidy $32.6 trillion over 10 years. That's on top of what the federal government spends on healthcare today. And this is not a new number. Other studies have found the cost to be roughly in the same range. So, how would we pay for it? Kenneth Thorpe, a professor at Emory University and health policy official in the Clinton administration, spells it out. If you are going to go in this direction, Medicare for all, the tax increases are going to be enormous.
Or you could just cut that vastly enormous military budget, which would also have the benefit of easing the strain on the system by not having to take specialist care of all of those injured service personnel from all of those imperialist wars that America gets into. And of course all of the saved lives would be quite nice too, wouldn't they? Oh sorry, I forgot. Prager U loves America getting into wars overseas. Silly me.
Canada knows all about exploding healthcare costs. In Ontario, the country's biggest province, those costs took up 46% of its entire budget in 2010. By 2030, that number is projected to be 80%.
Again, I'm going to have to call bullshit on this one because I looked everywhere for that 80% figure and I couldn't fucking find it. Because I had to, of course, because once again you didn't provide any fucking source for that claim, so I looked for it everywhere and it was nowhere to be fucking found. So I'm going to say you pulled it out of your ass again. And another reason for me to distrust your figures is that according to the Fraser Institute, you actually got your 2010 figure wrong as well, but in the opposite direction. The figure was actually 49.5%. You understated it, for fuck's sake. You hack idiots. You really are terrible at this. But anyways, what I did find while digging was that the figure for the overall government spend on healthcare in Canada was 12%. But obviously you couldn't go with that number because it's nowhere near as scary as your made up 80% figure. Jesus Christ, you fuckers are so dishonest, Prager. I don't know how you sleep at night.
Single payer, free healthcare, Medicare for all, they might sound great, but like all visions of utopia, they ultimately produce a lot more harm than good.
Jesus fucking Christ, there's nothing utopian about the idea of healthcare being accessible to those who need it, you fucking propagandist. I can't believe that allowing doctors to treat patients without having to go through insurance companies is considered utopian to these bastards. America, you can do so much better than your current system, which is there driven entirely by fucking profits rather than, making sick people not so sick anymore. You would be so much more happy and satisfied with a single-payer system than your current system. Just ask the people of single-payer systems. They'll tell you. So please, 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 don't listen to the billionaire-backed propagandist shill bastards, Prager quote-unquote university, and their acolytes in dishonesty, propaganda, lies, and fucking greed. They give not a fuck for you, your family, or the general well-being of Americans. Anyways, I'm done, right. I hope you enjoyed this dissection of right-wing bullshittery, and, Prager, F you. It's still clever. It's still so fucking clever. But anyways, to end on, I'll leave you with the immortal words of the great Aneurin Bevan, the man who established the National Health Service here in the UK and is one of my personal political heroes.